At 6:13, the United States has the highest rate of maternal death of any high-income nation.
The black maternal mortality rate, we are 3 to 4 times more likely to die than our white counterparts.
Over the last 2 weeks, I showed you the work singer and songwriter Jewel is doing with Crystal Bridges to improve mental health. I attended a wellness festival at the museum in Bentonville, Arkansas, and talked with Tanya Lewis-Lee, who co-produced the Emmy-nominated film Aftershock about our country's maternal mortality crisis. It's on her mind.
When black mothers die, there's a ripple effect. We call it aftershock.
You know, it's often that, women are hysterical, just rest, you'll be okay.
My daughter's story is loud, colorful, and artful.
Director and producer Tanya Lewis-Lee shares the experience of 30-year-old Shamani Gibson, who died of a pulmonary embolism in 2019, 13 days after delivering her son. She knew something wasn't right, but doctors dismissed her symptoms. Just a few months later, Shamani's partner, Omari Maynard, connected with the partner of 26-year-old Amber Rose Isaac when she died in 2020. Just a few days after tweeting she should write an expose on incompetent doctors. She wound up having an emergency C-section and bled to death. Both women were young and healthy. Both deaths were preventable.
People really need to listen. Doctors, healthcare providers need to really listen because women do know how they're feeling. They do know their bodies.
The film centers around how the two men are left to raise their babies alone and digs into how birth has become over-medicalized.
Why are we giving birth in hospitals where there are sick people and people are dying? Women who are pregnant are not sick. Women are not sick. This is a very natural process.
Aftershock looks at other countries with better outcomes and finds they use doulas and midwives. It explores racism and the criminalization of midwifery that started in the 1920s in the U.S.
Midwives are trained clinicians. We have to understand that. They are trained clinicians. They know what they're doing. And actually, statistically, their outcomes are better.
Data shows, like Shamani and Amber, 80% of these maternal deaths are preventable. The film talks with Dr. Neil Shah, a Harvard OBGYN, who says there's been an explosion in C-section rates since the 1970s. The surgeries take less time and cost the hospital less money, but bring in more money. They also bring more risks to the mother. Lee says the system values profits over lives.
It shouldn't be rushed. Our bodies do things for certain reasons, right? Let the body take its time. Let a woman go through the process.
The film also features a positive birthing experience right here in Tulsa. The most eye-opening line in the movie, when pregnant mom Felicia Ellis says a black woman having a baby is like a black man at a traffic stop with the police, explaining her fear about delivering in a hospital and why she chooses a doula.
As Felicia in my film says, it's the hardest thing she's ever done, but she knows she can do anything after that. All of these things, I think, we need to be thinking about and questioning and figuring out, again, what works for each individual woman.
Omari and Bruce suddenly became single dads and maternal health advocates, sharing their unimaginable loss and pushing for change.
The beautiful thing is the film has been seen a lot by medical schools, by hospitals, by insurance companies, by community. My hope is that in the medical field there are conversations about what it means to treat patients of different backgrounds and different ethnicities, how to have compassion and empathy for people who may not come from the same space as you. Birthing is not a one-size-fits-all, and I think every woman has to figure out what really works for her.
Aftershock is on Hulu, and you can learn more about the Black maternal health crisis at aftershockdocumentary.com. We've got links to 2 nonprofits to fight black maternal mortality established in memory of Shamani and Amber Rose in this story on fox23.com. You can just click on her mind at the top. Next week, I am going to take you to the first hospital-based midwifery birthing center in the state of Oklahoma. So they are hoping to give women more options, but still have the resources of a hospital right there, hoping to improve outcomes. So it's really unique, and I will take you there next week. What's on your mind? Email on her mind at fox23.com.